Hear the Appleseed every Thursday at noon, right here on the information and cultural beacon of the Four Corners, KSJE, Farmington, New Mexico.
KSJE is supported by the Farmington Civic Center, bringing a full slate of entertainment to Farmington and San Juan County. The feel-good show, The Choir of Man, Tuesday, January 11th at 7:30 p.m. The Farmington Civic Center, 200 West Arrington in downtown Farmington. Find out more online at fmtn.org/shows or 505-599-1148.
Good morning, everyone. I'm Megan Cullop, along here with Scott Michlin.
Good morning, Megan Cullop, along here with Scott Michlin. It's nice to see you.
That's my last name now.
Yeah.
It's hyphenated.
Right.
Cullop, along here with Scott Michlin.
That's right. That's right. Happy New Year.
Hey, thanks. Happy 2022.
Yeah, it is Friday, January 7th.
Did you think we were going to do the COVID show all the way up to 2022? When we started this?
I did not. In 2020, March of 2020.
Yeah.
Yeah. We're going to have to think of something for our 2-year anniversary, I'm afraid, in March. Yeah. Anyway, but we're glad that you are with us, both you and the audience. Welcome, everyone. We are here to continue the COVID-19 Community Information Program into 2022 because COVID is still with us. As much as we would like it to go away, it has not yet, and there are still important things to talk about COVID-19 in San Juan County, which is why we are here every other week, and we will continue to be for the foreseeable future, I'm afraid. But when conditions change, the show will change, as it has been evolving and devolving over the last 2 years.
Yeah. Yes.
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 So, anyway, so here we are. Anyway, but welcome back. It's good to have you here.
Yeah, it's good to be back.
In the studio. We have some guests that will be joining us this hour, so we want to make sure everybody's aware. We'll be hearing from 2 doctors from San Juan Regional Medical Center, both friends of the show, as we have mentioned.
Long-standing friends of the show now.
Right. They've been with us since the, I think, almost very beginning.
Yeah.
Dr. Erin Philpott and Dr. Brad Greenberg will be calling in just a moment to give us an update on conditions at the hospital and what they are seeing and dealing with day in, day out. Then we'll also get an update from the New Mexico Department of Health. Their spokesperson, Matt Bieber, will be calling in later on this hour to talk to us a little bit about the statewide picture and how things are looking. And of course, everyone's talking about the Omicron variant. Vagrant? I don't know.
Vagrant.
Yeah.
The
variant, the Omicron variant, pardon me, everyone. And the last time we spoke, and you weren't here for that show, but it had just made it into New Mexico, but I believe Dr. Greenberg told me they hadn't seen any Omicron cases at San Juan Regional Medical Center. That was mid-December, so we'll see if that has changed.
Might have changed, yeah.
Yeah, exactly. So anyway, so that's what's coming up. In the meantime, though, we have a couple things to pass along, including the cases that we've been watching, of course, and this is off of the dashboard that the state keeps up to date every day. As you can see, the weekly case numbers, that average, the 7-day average, is still falling in San Juan County, which is good.
Right.
I was afraid, and I'm afraid it may go back up. Recent cases have been high again, but again, as we average them out, that's why we do that, so that we get kind of that average number. And this is through the end, about mid-December, I'm afraid. So that's what we're looking at.
Gotcha.
So December 15th is that last little bit. So we'll see how we ended the year next time.
Yeah.
When we visit.
I'm very surprised by the highest peak being just around October, November of this year.
But that's a Delta peak, I'm afraid, and we haven't seen Omicron here, and I think that's why we're not seeing the higher cases of Omicron yet.
Right.
And that could be a different story.
Right.
So which is why the advice still is get tested, get vaccinated, get boosted, wash your hands, wear a mask, distance yourself from other people, all the things we've been talking about for almost 2 years.
Don't touch your face, which is really hard to do.
And don't touch your face.
That's
right. I never touch my face. I haven't touched my face in a year and a half.
I bet your skin is healthier.
Maybe it is. I don't know. But there you go. So that's where we are. So that's what's happening on the weekly case count. And then, of course, if we look at the other COVID-19 dashboard from the state, this goes all the way up to January 3rd. We can see that the cases per 100,000 is now at 43.6. And actually, from the last time we spoke in mid-December, that's down from 61.2. And the positivity rate, which is kind of how fast things are spreading in San Juan County, is 12.24%, and that's down from 13.38%. So it's heading in the right direction, but it's still not. If you remember back when we were talking red, green, blue, turquoise, you know, these are we would never get to any of these. We'd be in red, which is where we are on the map. So so there you go. So that's what's going on.
Gotcha.
That's what's happening. So all right.
Gotcha.
You with me?
Yeah.
All right. There you go. We have one guest on the phone this morning. Maybe it's two on the same line. Should we find out?
Let's find out.
Okay. Good morning. You're on KSJE. Thanks for calling in this morning.
Good morning. This is Erin Philpott. How are you?
Good morning, Dr. Philpott. We are well. Happy New Year to you. We're glad to have you on the program.
Thanks. You too.
You've made Megan's day because she loves talking to you, as do I.
Yeah.
And then we're expecting, is Dr. Greenberg going to join us, do you think, this morning?
I believe so, yes.
Okay. I'll keep an eye on the phone. But since you were the first to call in, guess what? You're on the air first.
Okay.
So, welcome. And to start things off, Dr. Philpott, I'm glad that you're on the phone with us this morning because I did want to call out your very eloquent column that you wrote for the local newspaper, the Farmington Daily Times, about your experiences at the hospital these past few weeks and months. I just wanted to let you know publicly I thought it was very well done, really heartfelt, and really expressed, I think, what a lot of your colleagues and peers are dealing with, not just in this state, but throughout the country. So thank you for sharing that with the audience.
Thanks so much, Scott. I appreciate that.
You're welcome. To get started, can we talk a little bit about how things are looking at the hospital? We just got through telling everyone about the cases, at least from the state's dashboard, seem to be lower, but I don't think they include any Omicron cases. Are we still seeing mostly Delta?
Yeah, great question. Overall, and I'll get to kind of the variants here in a second, overall our cases have come down, at least our hospitalized cases have come down significantly over the past probably 3 weeks or so. We're holding at a census in the range of 40s for COVID patients. But, you know, we're picking up, as we usually do, between surges like this of non-COVID patients. That are just, you know, it's not sure why this phenomenon occurs, but it does each time. So lots of really sick individuals with other illnesses beyond COVID. As far as the variants of concern, or Omicron, which is the one, of course, everyone has their eye on, to my knowledge, we don't have any definitive data that we have received from the Department of Health sort of outlining if we have Omicron cases in our county yet. There are, I think, 29 reported on the data dashboard on the Department of Health website. And Dr. Greenberg may have more updated information on this. I saw in some of the news media reports yesterday, it looked like officials, they had stated, were quoting about 50% of cases may be Omicron now. So in sum, we're uncertain how many of our current cases are Omicron, but it seems it hasn't, based on just the transmissibility and sort of how fast people are passing it around, we've probably not seen it yet in full swing, though it's most likely kind of in the early stages passing around our community. And that's purely my speculation based on the information I know so far.
Understood. But you're telling us the case numbers so far are at least lower at the hospital maybe than they were a month ago, which sounds like good news.
Yes.
Okay.
Absolutely.
Very good. Thank you very much, Dr. Philpott. Let me let me hit your button here an extra time so we can also bring in Dr. Greenberg, I believe, on the phone with us this morning, who's also joining us this morning. Dr. Greenberg, is that you? Good morning.
Good morning, Scott. How are you?
I'm well, thank you. We've been talking with Dr. Philpott just briefly about the lower case numbers at the hospital, which we're very glad to see, but she was just telling us that we haven't seen, at least so far as we can tell from the Department of State, any Omicron variant cases in San Juan County. I'm going to pass things over to Megan, who I know is just waiting patiently for me to stop talking so she can ask a question.
Yeah, no,
for the first time in a month.
That's right. Yeah, hey guys. No, my question is related to this the statement about this variant being a milder form, and I think that that's kind of led to some lackadaisical feelings around and behaviors around what's going on. And so I'd like you guys just to speak to what that means. I mean, is it true that this is milder? What does that mean for our behavior, our community? So maybe Dr. Greenberg, since you just jumped on, you can take that first.
Sure, happy to. There is a bit of a mixed bag of information, and I do think it's important to kind of unpack this. Now, right now, though, we are seeing unprecedented increases and really record case numbers across the country, like increases by 204% in the last 14 days. This is, by far, the fastest spreading COVID-19 variant thus far. Across the country, we're seeing well over 500,000 cases per day. And we're seeing, challenges with testing supplies, supply chain disruption, travel-related issues, work and school-related disruptions. And this is very concerning. I mean, hospitalizations have actually shown an increase in 35% in the last 14 days across the country. But there is a silver lining, like you alluded to, Megan. But there's some nuance to it. And the risks for ED visits, hospitalizations, ICU admissions, and mechanical ventilation were consistently less than half among Omicron infections when compared with Delta infections. So on a person-by-person basis, it seems like, the risk of serious or the risk of severe COVID is less. And it also looks like the case incidence, so the unprecedented, amazing number of cases and hospitalizations, those two numbers look to have basically decoupled. So on a person-by-person basis, less people are sick. However, the sheer vast number of the simultaneously ill, 500,000 cases a day, means that hospital systems and hospitals like ours are still having considerable challenges. And this still represents a really serious threat to healthcare infrastructure. So even though on a case-by-case basis, it looks like things are a little bit better when compared with previous variants, the aggregate means that there's a really huge demand for healthcare services. Now, we don't know quite what's going to happen from a mortality and morbidity perspective, but we know that the inpatient demand continues to be fueled by the unvaccinated. So please, please, please get vaccinated. And the Omicron variant across our whole country and in communities is still a very big deal. Let's take this silver lining and not let it subvert our need to get vaccinated and practice COVID-safe practices.
Very helpful. Thank you. And Dr. Philpott, do you have anything to add?
Yeah, I think just another couple aspects of our current situation that play into sort of what we may see with the Omicron variant. We're seeing across the country, as Dr. Greenberg alluded to, a large number of workers being infected in whatever industry that may be. And of course, in healthcare, we're very concerned about that possibility. So people not necessarily getting extremely sick, but our vaccinated healthcare workers, we are seeing more breakthrough infections. Though the vaccines are still protecting against severe disease and hospitalization, those breakthrough infections among vaccinated individuals are, of course, required to self-isolate. So we're already hearing stories from other hospitals in the Intermountain West that are having to close beds and are extremely strained due to the lack of available staff. So we're having just kind of, these drops of other things in to make it even more challenging. I think additionally, these other tools we've had, like the monoclonal antibodies, which were fairly effective at preventing severe illness and hospitalization through the Delta surge, were whittled down to only a single monoclonal antibody that is active against Omicron, sotrovimab. So the Eli Lilly and the Regeneron products that a lot of people received during our last surge are no longer available. So it's just kind of the mass demand for all these different things with so many cases can really impact all these different elements.
Thank you very much, Dr. Philpott. And I wanted to ask you both, too, and Dr. Greenberg, I'll start with you, about long COVID. We haven't talked too much about that recently, and with this Omicron variant that may have less of an impact, though, we're still hearing from folks who've maybe had COVID and are feeling okay, but they still have some of these long COVID symptoms and other, damage to their lungs or hearts or things along that line from the infection, from the virus. And Dr. Greenberg, is that still something that you and your colleagues are having to deal with and patients are having to deal with? And does it affect unvaccinated folks worse than the vaccinated population?
Long COVID is absolutely an ongoing concern. And we really do, it looks like vaccination both helps mitigate the likelihood of infection and therefore long COVID, and also becoming vaccinated after your infection appears to mitigate some of the symptoms of long COVID. The numbers that we had been using for some time are that 30% of people that develop a COVID infection, even if the COVID infection itself is relatively mild, can develop long COVID. And that is a constellation of fatigue, cough, intermittent chest tightness, occasional shortness of breath, body aches, and sometimes some difficulty to focus, like some cognitive challenges, have been reported in long COVID. And it remains something where there are now clinics that are being stood up across the country to look at the impacts and the multidisciplinary approach to long COVID. But this is something where the best treatment for long COVID is to not get it in the first place. So we remain very concerned about it, and medicine, I would say medicine in general, is doing its best to try to respond to this and to build an approach that helps relieve pain and suffering.
Thank you very much, Dr. Greenberg. Dr. Philpott, do you have anything to add to that with patients suffering from these long COVID impacts to their health?
Yeah, I think the only thing I would say is, and we talked about this just yesterday at the hospital, each of these variants has such distinctive features that I think that demonstrates there's different physiologic impacts on the body. Early on, like for example, Omicron doesn't look like it's impacting our sense of smell. And losing the sense of smell demonstrated this neurotropism, meaning the virus probably went up, more into the brain or affected the nervous system. So after the Delta surge, which has by far and away been our worst yet as far as mortality and sort of challenges there, I think it's really early to say how we're all going to be impacted, or how society and all the people who were infected with COVID are going to be impacted on a long-term basis. So I think there's going to be just constant emerging data, and it's going to be so variable and difficult to sort through because everyone, we obviously don't know which variants we have had if we get COVID, but I think we'll get more information as time goes on.
Very helpful. And now I guess our last question before we go, and nobody has a crystal ball, but should we be bracing ourselves for the next surge given this new variant? Dr. Philpott, why don't you take that first?
Yes, I think, your first question, people are looking out through rose-colored glasses. This is mild illness, and have just sort of succumbed to the idea that we're likely all going to get Omicron vaccinated or unvaccinated. Of course, those unvaccinated with the potential for much more severe disease. But I unfortunately think we need to be bracing ourselves for it, and I think we need to really heighten our rigor. The previous public health measures, or how we've acted in the grocery store, are unlikely to be effective compared to, of course, depending what you did, but compared to past variants. It's just highly infectious. So not wearing a mask, even if you're vaccinated, is no longer appropriate for Omicron. And I would just encourage the community to please help us. We are going to have a really rough, probably month, 4 to 8 weeks coming up, depending what unfolds here, just based on the case trajectories being so steep.
And Dr. Greenberg, before we go, do you have anything to add to that?
You know, one of the things that's been a hallmark of this pandemic is that how we do as a community really, it truly is the sum of our own individual choices. And as Dr. Philpott was saying, this time, for these coming weeks, the ask for each and every one, anyone who's listening and anyone who can talk to anyone else and their friends, family, and community is that let's buckle down. Let's get this case rate per 100,000. In La Plata County, for example, just to the north, it's 934 per 100,000. That is an incredible number. It's really high. Let's all buckle down. Let's do hand washing. Let's mask appropriately. Let's really be careful. For these coming weeks, this is a wave. It's not going to be forever, but this is a wave, and now is the time when we need to pay some attention to it. Because I agree, I think that we are bracing ourselves, especially at the hospital, bracing ourselves for an increase in demand in a number of settings. And we look to each and every member of our community to do their part, to make the right kinds of choices, to help buffer that so we can be here for you in any time of illness and injury.
Dr. Brad Greenberg and Dr. Erin Philpott, we always appreciate your time with us on the program. Thank you both for joining us this morning.
Thank you. Have a great day.
Thank you.
Thank you. You too as well. Dr. Erin Philpott, Dr. Brad Greenberg from San Juan Regional Medical Center, our guest this morning here on KSJE on our COVID-19 Community Information Program. I'm Scott Michlin here with Megan Cullop, and there you go. That's the latest.
I got braced for another surge.
I'm afraid so.
I was worried that was going to be the answer.
Yeah.
But you got to ask.
You have to ask.
Yeah.
You have to ask, and they have to be ready, as
Right.
they have been.
Yeah.
For almost 2 years.
Yeah.
Right? Yeah. So, anyway, so we appreciate their time. And, of course, they're always willing to be back. We'll be back, of course, with this program in another week and a half. We do have another guest who'll be calling in momentarily. But in the meantime, we do want to talk about some testing sites that are available. And I know there's been news nationwide about the shortage of tests. And I don't think we're seeing that in New Mexico. That's a question for our next guest.
Personal anecdote.
Yes, ma'am.
I've seen it.
Really?
Yeah, I was
do
just
tell.
away, and so to be prudent, I came back and tried to find a rapid, COVID test over the counter.
Right.
Anyway, none to be found.
Nothing over the counter. I see.
None to be found. Not OTC.
Right.
Over the counter.
I gotcha.
Yeah.
But did you have to go to a testing site then?
A friend of mine had an extra one.
An extra test.
Yes.
I gotcha. I guess I was thinking more of the testing locations that are up, and I don't think they are having as much problem in New Mexico as we're hearing from other parts of the state.
Got it.
But that's what I thought.
Okay.
But anyway, thank you for sharing that.
Yeah.
I believe our next guest has called in, so we can actually go to him at the moment. This should be Matt Bieber from the New Mexico Department of Health, is it?
You got it. Hey, Scott, how you doing?
Good morning. I'm good. It's kind of like phone roulette here this morning sometimes when we wonder who's on the phone. But thank you for calling in, Matt. We were just talking about testing, and Megan was mentioning that she had a hard time finding an over-the-counter test, but I was thinking that in New Mexico, our testing centers are still fairly well supplied for COVID tests. Is that true statewide?
It's a mixed bag. Yeah, it's certainly a challenge right now. There's a national shortage of the at-home tests, and so we're seeing that reflected everywhere, really. They're harder to find on the shelves, and they're harder to order, but you still can. You can still order, for example, from Vault and get at-home tests delivered to you. You can order packs of Binax Now tests on their website. You have to pay a little bit for that. And then, yes, the state continues to offer a whole range of testing sites, both through us directly and through partners like Curative. Probably the best single thing folks can do is go to findatestnm.org, and I'm going to double check the link there for you. I'm pretty sure it's findatestnm.org, and that'll give a list of testing sites nearby.
Got it. Okay. Well, thanks for that. So give us an update on the statewide situation. We were just talking to two local doctors who mentioned that they don't see, at least from the data they're getting from your department, any evidence yet of the Omicron variant in San Juan County. Is that true from what you're seeing? Is it mostly concentrated maybe in Bernalillo County these days, or Las Cruces area?
You know, that's a great question. I can't speak to the county level data, but I will say I'd be surprised if that were true. And the reason is because, as we announced at the press conference on Wednesday, Omicron is now something like 50% of cases in the state. So I'd be really surprised if there were no cases in your neck of the woods. And that number is projected to increase nearly to 100%. We're going to see the same thing most likely with Omicron that we saw with Delta. It's just going to take over completely. So if it's not there somehow at this point, it will be soon.
Got it. And thanks for that. I think that's what the doctors were telling us as well, that they are just kind of bracing for that next wave, which will probably be an Omicron wave of cases, as we are seeing in other parts of the country.
So, I mean, we might have sort of beat this into the ground about vaccines, but is there anything new to say about vaccines, or is it the same, just go get it done? Where are we at with the vaccine situation?
Yeah, thanks for that question. Yeah, well, things have opened up even further with regard to booster eligibility. So the CDC put out some updated guidance, and I'm going to draw up the details here and then be able to recite them to you momentarily. But broadly speaking, boosters are now available to younger kids. We're talking teenagers now, and they've also shortened the timeline for waiting for your second your booster shot in some cases from 6 months down to 5 months. If you don't mind, let's circle around to some other topics, and I'll bring up the precise details of the new guidance so we can talk about exactly who's eligible right now.
Got it. Well, and of course, there is a case that I think the Supreme Court is dealing with some of the other federal vaccine kind of mandates that we are hearing, the OSHA law, and I know the state is following that. I imagine the state will take its guidance from whatever the Supreme Court has to say about this directive from the president. Is that kind of what you're watching today?
Yeah, I certainly will be paying attention to that. I think, we obviously as a state have some vaccine and test mandates already in place at the state level. But you're right. I think we're talking about the same one here, the one that requires employers of 100 or more employees to have folks vaccinated. That was announced many months ago, but then was only the rules were only formulated a little bit more recently, and I'm not totally sure if they're even finalized. And so it'll be interesting to see how the courts respond to those kinds of requirements. I think it is, and I did find the details here, so I'm happy to review them real quickly if you'd like, about the expanded eligibility.
Yes, let's talk about that for a minute.
Great. So the CDC did a couple of things with regard to the Pfizer vaccine this week. This was after extensive review by both the FDA and the CDC. Basically, they said anybody 12 and older who received a Pfizer primary series, they now recommend a booster at 5 months, not 6. So if you or anyone in your family got your primary series with Pfizer, then you shouldn't be waiting really any longer than 5 months to go get that booster. And then children, or adolescents, I should say, 12 to 17, should get a booster 5 months after completion of the primary series. This is a strongly worded recommendation. And then there's a slight adjustment for children ages 5 to 11 who are immune compromised. So if they have an immune compromised condition, they can receive a booster 28 days after they finish their primary series. And previously this was only eligible for folks 12 and older, but now kids 5 to 11 can get a booster 28 days after their primary series is done. So I think what we're seeing is that the boosters, the value of the boosters is being more and more recognized, and they're being recommended slightly sooner after the initial primary series.
Very good. And so there's some talk on the federal level about residents being sent masks and at-home tests. Is that something that the state of New Mexico will be engaging in, or what's the story there?
Great question. Yeah, I mean, obviously any resources that the Biden administration, the federal government make available with regard to testing or masks or anything else that can help, we'll obviously want to be a part of that. You may have noticed also this week that there's a bill in the legislature here in New Mexico for this upcoming session. One legislator is actually looking to do something similar, provide a bunch of money so that DOH can distribute, I think it's both testing kits and masks. The DOH has just gotten the bill and is just looking it over now, so we'll obviously be in conversations with that legislator and others about that idea. But broadly speaking, in the spirit of things, we're totally on board. We want to make testing and especially masks available to anyone who wants them at any time, and remove whatever barriers may exist for folks in those areas.
Great. And Matt, before we let you go, is there anything else that you would like to share?
I think we've covered it pretty well. One of the things that I'm wrestling with, I think a bunch of us here in the department and the state government are wrestling with, and I know our neighbors across New Mexico are wrestling with, is where are we headed? What does Omicron mean? Because on one hand, we're seeing many more cases. We now had, yesterday was something, I don't know if it was an actual record for us in terms of daily case counts, but it was certainly very high. And we're seeing a lot more cases. We're also seeing some indication that the hospitalizations and deaths may decrease, that illness may be milder with Omicron. Dr. Scrace actually thinks it's a little premature to make that call. And so we're just recognizing that there's a lot of uncertainty here about where we're headed. What does this new variant mean, right? If there's a lot more cases, but people tend to get a little less sick, and we end up with the same number of people in the hospital, is that a good thing or a bad thing? So there's a lot of uncertainty here. And I just ask the continued patience and resilience of the New Mexicans who've shown it all along for 2 years now. And let's just stay current. Let's keep following the evidence where it leads, and let's continue to make good choices given the situation we're in to protect ourselves and our families. I think one conversation we had just yesterday internally was how, we recognize that at some level, lots of folks are a little tired of this situation. And I hear that feeling. And yet, at the same time, unfortunately, just making the right choices doesn't entitle us to a result. It doesn't, just because we've all gotten vaccinated and wearing a mask, it doesn't mean that the vaccine is going to go away just because we want it to. We still have to continue making good choices to navigate in the present with what we're facing. And I think by and large, folks are doing that. They're showing this remarkable adaptability, this willingness to just say, okay, what's next? Like, how can we continue to make good choices for ourselves and others? And I admire the heck out of it, and would love to see that continue. So thanks for everybody who's just shown up with a good spirit and good cheer to get us all through this together.
Agreed. Thank you, Matt. And thanks, as always, for joining us this morning. It's really, it's really helpful to have somebody from your point of view come and share all the important information for us. And so just thanks again for coming on.
Absolutely. Thanks for making the space, and we'll talk to you soon.
All right, very good. That's Matt Bieber from the New Mexico Department of Health with us on our COVID-19 Community Information Program. Before we go, as I mentioned, there are some testing locations we always like to remind you about for COVID testing. There's a new location that is relatively new, I think within the past week or so, which is from a new provider as well. This is Embry Health. They have set up outside the Riverstone Church there at 803 North Monterey Avenue in Farmington, kind of between Monterey and Butler and Isleta, if you will, as you can see in the picture there on the screen. Anyway, they are open for testing Monday through Friday, 9 a.m. to 5 p.m., and they have a website that you can pick an appointment. I think they have every 10 minutes, and you can set an appointment and go drive through there and get tested, zero cost COVID-19 testing. Again, it's Embry, E-M-B-R-Y, Embry Health has set up there at the Riverstone Church in Farmington. The other rapid PCR testing site that Curative has opened up in Farmington is at the Old Tibbetts Library over at 304 East Apache Street. They are open now Monday through Friday, noon to 7, and on Saturdays and Sundays, 9 to 4. And that's, again, run by Curative. And then their website, cur.tv/Old Tibbetts. I like that.
I like that. I mean, I like a lot of things about this, but like my favorite is that it's still called a library.
Yeah. Well, that's the building.
No, yeah, it's like,
because the rest of the building is a pile of dirt.
It's a pile of dirt. Yeah.
But the Old Tibbetts Library. So that is available, as well as the other existing sites that we've been telling you about. Aztec Schools has one at Fred Cook Stadium Wednesdays and Fridays, 7 a.m. to 3 p.m. That has been, I think, remained open here. Mickey Park, of course, out on County Road 5568 or Highway 64. They are open Monday through Friday, 8 a.m. to 3 p.m. The Farmington School District Office on 30th Street at 3401 East 30th. Again, Mondays, Tuesdays, and Thursdays. They are still doing the COVID-19 PCR tests, so we just wanted to make that information available to everyone before we go today, and to thank our guests who have been with us this morning. We really appreciate their information.
Right, quality guests. They're all three of them are friends of the show at this point.
They should be. I think we need to send Matt Bieber a T-shirt or something, or hat,
right?
or
Because
something.
the other two got a T-shirt.
I think they got a hat.
Oh,
They're
a hat
doctors.
that works.
Yeah.
They don't wear T-shirts.
I don't know if they
wear
wear
hats.
T-shirts, but you know.
Anyway, either way, it's swag.
We appreciate,
Gotta
but we
see the
appreciate
swag.
their time. I think
Yeah.
that's pale, compensation for being with us
Yes.
for 2 years to get a hat.
Yes.
But we appreciate it. So anyway, and we appreciate you, everybody, tuning in week in, week out. Again, we are back in the new year every other week. So we'll be back in 2 weeks. But next week, we'll be going back to our Solutions from the Street program on Friday, a very special program because there's an event coming up for Martin Luther King Day that we're going to be mentioning. And Megan, you may know a thing or two about that. So
Yeah.
that'll
I
be
know some things.
mostly your show, probably. But
No.
a great opportunity and
Yes.
a great, I think, a great representation of the whole concept of Solutions from the Street because this really came from the street.
Yeah, absolutely.
We'll be back next
Yeah.
week, everybody. Until then, stay well and stay safe. And thanks for joining us on KSJE. Bye-bye.
Cases are high and it's overwhelming our healthcare system. The caregivers at San Juan Regional Medical Center need your help.
Our resources are exhausted. We're very limited on what we have the capacity to do because we're being overwhelmed with the number of individuals that are requiring ICU care at this point.
So what can you do to help? Most importantly, ignore the rhetoric and get vaccinated.
Continue hand washing, continue to wear your mask and social distance.
Help us so we can help you.